Hello, so for our agency presentation, we chose the Catholic Charities of San Bernardino and Riverside counties. This is just a brief overview over what we will be talking in our presentation. So, Catholic Charities of San Bernardino and Riverside County have been a cornerstone of support in the community since 1980. As a 501 nonprofit and the official social outreach ministry of the Diocese of San Bernardino, the organization is deeply rooted in values of compassion, dignity, and service. What makes Catholic Charities unique is its open door approach. People of all backgrounds are welcome and supported, regardless of their faith or circumstances. Their mission is summed up in their motto, providing help and creating hope. They focus on meeting immediate needs like food and housing, and on fostering long term growth and self resilience through counseling, education, and career support. Every year, thousands of individuals and families are positively impacted by their programs, from hunger relief to citizenship report. The organization works to reduce poverty, strengthen families, and build a foundation for thriving communities. Catholic Charities stands as a trusted partner, walking alongside individuals on their journey towards stability and hope. So, who do they serve? They serve low income individuals and families who are struggling to meet basic needs such as food, housing, and healthcare, seniors who are on fixed incomes who face food insecurity and limited access to support services, children and youth, including those in schools who benefit from early mental health intervention and emotional support programs, immigrant and refugee communities who face language barriers, legal challenges, and lack of access to affordable immigration assistance. The uninsured and underinsured individuals who need help navigating complex healthcare systems and securing coverage. Unemployed or underemployed individuals, especially women and people of color, who face barriers to stable, meaningful employment. Communities impacted by natural disasters or emergencies, particularly those without the financial safety nets to recover on their own. And then people experiencing housing instability or homelessness, including families on the brink of eviction. Catholic Charities serve the community through a comprehensive network of programs designed to meet both urgent needs and create pathways for lasting resilience. So, first, they offer hunger relief. With over 574,000 people in the region living below the poverty line, food insecurity is a critical issue. And Catholic Charities responds through food distributions, parish based pantries, food vouchers, and CalFresh education. They're working to establish 92 super pantries to ensure families can consistently access nutritious food. They also offer counseling support. Mental health remains a major barrier for many due to the stigma and financial challenges. The organization provides telehealth and in person counseling, school based early intervention programs, and community workshops. Over 16,000 community members have been served through these initiatives, offering trauma informed, accessible care. And they also help with healthcare access. Roughly 367,000 local residents struggle to secure healthcare coverage. Catholic Charities assists with Medi-Cal enrollment, redeterminations, and telehealth guidance while addressing social determinants like housing and food to improve long term health outcomes. Continuing with how they serve, they help with citizenship pathways. For immigrant communities, navigating the legal system is often overwhelming. The organization offers affordable legal consultations, form assistance, citizenship workshops, and know your rights education. In 1 year, they served over 2,000 individuals with more than 2,500 acts of service. They also advise with careers. Economic independence is essential for stability. Through resume workshops, job application supports, financial literacy training, and pilot programs like LVN certifications, they equipped individuals, with many from marginalized backgrounds, with skills and opportunities to secure meaningful employment. And finally, disaster relief. In times of crisis like wildfires, Catholic Charities responds within 48 hours, providing emergency aid, case management, and long-term housing recovery support while strengthening community preparedness for future disasters. These service pillars work together to create a long-term safety net and empower individuals to move from crisis to stability. Securing your legacy focuses on a powerful way to make a lasting impact through wills, trust, and beneficiary designations. Including Catholic Charities in your will or trust allows your values and generosity to continue supporting the community long after your lifetime. Whether someone's 18 or 108, having a will is an essential part of planning for the future. It gives people control over their property and allows them to name guardians for children and ensures their personal wishes are honored. Many supporters choose to leave a portion of their estate to Catholic Charities through their will or trust. This kind of planned giving can help reduce estate tax burdens while ensuring that causes they care about continue to receive support. People often gift financial accounts, real estate, vehicles, personal property, or even modernist assets like crypto or NFTs. Another option is through beneficiary designations. Certain assets like IRAs, 401ks, life insurance policies, and joint property don't pass through a will. By naming Catholic Charities as a beneficiary, supporters can make a meaningful gift often with tax advantages for their heirs. To make the process even easier, Catholic Charities offers a free revocable living trust tool, helping individuals and family plan their estates without their usual barriers. Ultimately, these types of planned gifts are about more than finances. They're about creating a lasting legacy that reflects your values and helps sustain vital services for generations to come.
Hey guys, so for the epidemiology section for Catholic Charities, we see that number one is barriers to care and coverage. And the Catholic Charities assess that over 300,000 residents have coverage challenges across the two counties, but they provide Medi-Cal enrollment and telehealth support to address these issues. Second is behavioral health, injury, violence, which are county level priority. And then San Bernardino's 2024 Community Health Assessment identified behavioral health, injury, violence prevention, and chronic disease as top community priorities based on data gap census. And number three, we have substance use and overdoses being fentanyl and synthetic opioids. Now, Riverside County reported a 25% decrease in overdose deaths in 2024, which is awesome, but they continue to be a monitor high-risk area. And we see that there's a free Narcan campaign going on in San Bernardino County offered by various EMS agencies such as American Medical Response. Number four is STIs on the rise. Congenital syphilis is one of those risks. Riverside County has, in fact, documented significant increases in syphilis, congenital cases as well, and public health advisories call for screening and treatment to increase, which is crucial for the prenatal community of clients. Number five, communicable diseases that disproportionately affect vulnerable groups, such as TB, HIV, influenza, respiratory illnesses, mpox, vector-borne disease, and coccidioidomycosis, valley fever. And they saw increases in 2024. And six, we have homelessness and housing insecurity, which happens to be affecting over 3,000 people experiencing homelessness. 69% are unsheltered, which is a huge problem. And lastly, we see chronic disease burden and disparities with Riverside counties. CHA flags rising diabetes prevalence and coronary heart disease mortality as key challenges that affect this community. So for epidemiologic issues and healthy people 2030 alignment with Catholic Charities of San Bernardino and Riverside County, we see number one is access to care and health equity, and over 300,000 residents lack stable healthcare access in these two counties. And for healthy people 2030 alignment, the first initiative is access to health services. The second is social determinants of health and nursing care. We can do is advocate for coverage enrollment through providing information on enrollment options and culturally competent outreach events. Number two, behavioral health and substance use. Now, behavioral health, suicide, opioid overdoses remain top concerns in both these counties. The alignment with healthy people is mental health, mental disorders initiative, reduce suicide rates, and substance use initiative to reduce overdose deaths. Now, nursing, we can take action and implement education to community members on effective coping mechanisms. For the third initiative, it pertains to infectious and communicable diseases. Now, syphilis, congenital syphilis, as mentioned on the previous slide, and TB rates are rising. For the Healthy People Alignment, this aligns with Sexually Transmitted Infections Initiative, reducing syphilis, and Immunizations and Infectious Diseases Initiative, which is increasing vaccination coverage. And for nurses, to take action, we can provide testing, prenatal screening, education on risk factors, signs and symptoms, and immunizations. Fourthly, it pertains to chronic disease management. Now, there has been elevated diabetes and hypertension rates climbing in these two counties. This aligns with Diabetes Initiative 1 to reduce diabetes. It pertains to high cholesterol initiative, which is increased BP control. And as nurses, we can lead prevention education and community screenings, educate members with hypertension on the importance of the DASH diet, which pertains to high fruits, low sodium, vegetables, low-fat dairy, and whole grains to decrease that blood pressure. Fifthly, we have homelessness and social detriments. 3,821 individuals experienced homelessness in 2025. The alignment with Healthy People is social detriments of health to reduce homelessness. And as nurses, we can coordinate to make shelter referrals to members, especially with wintertime temperatures rapidly decreasing and coming upon us. Lastly, we have immigrant and vulnerable populations. Now, immigrant enforcement fears reduce clinic visits to the Catholic Charities of San Bernardino and Riverside counties. So now, for the Healthy People Alignment, this pertains to immunization of infectious diseases, increasing the flu vaccination numbers, and social detriments of health framework on discrimination. And lastly, as nurses, we can provide trusted, language-appropriate care with interpreters if needed, and community outreach events to those afraid of being deported and not wanting to come to the facility.
Hi, I'm Sophia, and one of the biggest things that we noticed during our site visit to Catholic Charities was how many different barriers people face just trying to get basic healthcare. For example, the staff talked a lot about issues with insurance. So a lot of their clients are either underinsured, uninsured, or honestly just confused about how to apply for Medi-Cal. Catholic Charities steps in with enrollment and redetermination support, but coming from a nursing perspective, this really highlights why people end up delaying preventative care or letting their chronic conditions go unmanaged. As future nurses, we probably need to coordinate with organizations like this to help make sure patients actually get connected to coverage so their care doesn't get interrupted. Another big area was food insecurity. Their hunger relief program is pretty extensive, including pantry items, fresh produce, food vouchers, even CalFresh enrollment help. Food insecurity plays a huge role in health outcomes, and it definitely affects things like diabetes and hypertension. So as future nurses, especially in community or public health settings, we need to screen patients for food insecurity and refer them to resources like this. We could even help collaborate with them for nutrition education, since proper diet is needed too, and it's tied in with disease management. We also learned about the mental health needs in this population. These charities offer counseling both in person and through telehealth. Many other clients are dealing with homelessness, trauma, immigration stress, poverty, all of which can seriously impact mental health. So if we're working in psych nursing or community nursing, we'd probably be doing a lot of referrals, following up, outpatient, and general support to make sure mental health is part of the patient's overall care plan. Another point that came up was immigration. Catholic Charities provides legal help and citizen support, but a lot of immigrants, especially those who are undocumented, are hesitant to seek healthcare at all. They might just be scared or unsure of their rights or unfamiliar with the system, and as nurses, we can play an important role in building trust and providing culturally competent care. And by understanding what services Catholic Charities offer, We can connect these patients with legal and social support that could improve their overall access to care. Overall, a big theme was the social determinants of health. Catholic Charities is basically addressing all of the major ones, including housing, food, employment, legal status. And as nurses, this means that we can't just assess someone's physical symptoms. We need to understand their social situation too. Working with an agency like this in the future might require more coordination and advocacy, but it's necessary if we want to care for the person as a whole. And lastly, something that surprised me was their focus on telehealth. They have a health hub that helps clients access telehealth services, but a lot of people still don't have reliable internet or the digital skills to navigate it. As nurses, we might have to help teach our patients how to use telehealth or provide alternatives if technology is a barrier. So overall, the site visit was really great, and it showed us how interconnected healthcare is with the social support systems and how agencies like Catholic Charities play a huge role in filling gaps that the healthcare system doesn't always match. So when we got to the Catholic Charities office in Ontario, the first thing that we noticed was how welcoming the staff was. Everyone we met seemed really mission driven, and you can tell they genuinely cared about the people that was coming in. Their space was pretty organized too. There was a private waiting area. They had some different counseling rooms and a small intake desk where they could take clients in. And as we were looking around, we saw a bunch of brochures for things like food assistance, CalFresh enrollment, and legal services. I think this really stood out to us as a group because it showed how integrated their programs are. We think that everything is very client centered, and it felt like a one-stop place for people dealing with multiple challenges. Something that really impacted us was hearing how an organization balanced crisis support with long-term empowerment. So they do offer emergency food and help with utilities, but they also provide things like career advising and legal pathways. And I believe that dual approach can be an immediate help to people who are looking for something more long-term and stable. We also noticed how diverse their client population was. We saw families with kids, seniors, immigrants, and people dealing with housing insecurities. And this range really just put into perspective how wide the need is and how many different groups rely on their services. When we talked with one of their coordinators, we learned that a lot of their clients are actually referred from like hospitals, clinics, or other nonprofits in the area. That shows how connected Catholic Charities are within the larger public health network, and it made us realize how collaboration takes how much collaboration it takes to support vulnerable populations. And I think as a group, we were also like surprised with how holistic their entire model is. They're not just handing out food or doing immigration paperwork; they're trying to address the root causes that make people vulnerable in the first place. From a nursing and public health perspective, we realized that agencies like Catholic Charities are essential community partners. Working with them could reduce hospital readmissions, support preventive care, and really help move communities towards greater health equity. Overall, I think we left the location feeling genuinely inspired by their mission, which is providing help and creating hope. It made us believe even more that strong collaborations between healthcare systems and social organizations are necessary, and if we want to see real lasting improvements in community health.
Hi, my name is Angelina, and I'll be going over the suggestions in this slide. So Catholic Charities already provide incredibly comprehensive services, but there are a few areas where strengthening or expanding programs could further improve outcomes for vulnerable populations. First, enhancing digital access would help more clients use the Health Hub and telehealth services. Many low-income or immigrant families struggle with reliable devices or internet access. So providing loaner tablets or like Wi-Fi hotspots or even digital literacy can help reduce that gap in care. And second, we recommend increasing community partnerships, collaborations with local clinics, nursing schools, shelters, and public health departments would allow for more dental screenings, immunization events, and health education sessions directly at the agency site. Third, we have expanding mental health resources, especially bilingual counseling, would better address the trauma, anxiety, and stress experienced by many clients. Group sessions or workshops would also increase access without requiring one-on-one appointments with clients. Another idea is strengthening nutrition support. Catholic Charities already provide food, but adding quick nutrition education or recipe demonstrations during distribution days would help families use these resources more effectively. And then fifth, we have immigration. And because of immigration fears, which are a major barrier to healthcare access, expanding multilingual outreach materials and legal clinic hours would help clients feel more safe and more informed. And then finally, we have establishing a structured volunteer training program, particularly involving nursing students because they could use the hours, could definitely increase the capacity for screenings, health education, and community referrals. And these improvements would reinforce Catholic Charities' mission of providing more immediate care and crisis support for long-term self-reliance. And this is our final slide. So in conclusion, Catholic Charities of St. Bernardino and Riverside counties is truly a cornerstone for vulnerable populations. Their programs address the root causes of poverty while also providing immediate support such as food, counseling, healthcare access, and legal services. The agency's integration of crisis intervention and long-term empowerment creates a model that supports both stability and long-term independence. And their work strongly aligns with Healthy People 2030, particularly in increasing access to care, reducing homelessness, addressing mental health needs, and providing nutrition security. This shows that the agency is not only filling gaps in the community, but also doing it in a way that aligns with national public health objectives. And we also saw during our site visit how committed and mission driven the staff were. They treat every client with dignity, and their programs are intentionally structured to address the complex layers of vulnerability, whether that involves immigration challenges, chronic disease, food insecurity, or mental health stressors. Moving forward, strengthening partnerships with healthcare systems and nursing programs are going to be key. Nurses play an essential role in connecting patients to agencies like Catholic Charities, and collaboration can reduce hospital readmissions, improve chronic disease management, and promote health equity. Overall, Catholic Charities is a vital community partner, and with continued expansion and collaboration, they can further improve the health and well-being of thousands of families across both counties. We thank you for watching this presentation, and the next slide should have all the references that we used in the making of this presentation. Thank you so much.